Hi everybody, my name is Hannah Jean Zapanta and today I will be discussing the House 3 person. So this discussion was based from three references. I used the Comprehensive Handbook of Psychological Assessment by Michelle Herson and her colleagues, and I also used two articles from the internet. The first article was, I cannot really find the title of the article, so I just you can check my PDF of this discussion. You can click the link below for references. And the second one is the practical psychology. It is the House Person personality test. It is retrieved from this link. So please refer to my attached discussion PDF for references. So in this discussion, we will be talking about the history of House Person, the test description, the purpose of the test, and its theoretical basis, the test development and psychometric characteristic, the methods and interpretation of the test, and the range of applicability and its limitations. So first, let's discuss about the House Person. So House Person, are also known as HTP, was developed in 1948 by John Bach and later updated in 1969 by Bach and Emanuel Hammer. So the test was designed to measure personality aspect, and it was originally based on good enough scale or draw a man test of intellectual functioning. So the House Person test was developed by early clinical psychologist John Bach in 1948. It was based on a draw a man personality test created by Florence Goodenough in 1926. So it was originally designed to assess children's intelligence, but Bach further updated the HTP test together with psychologist Emanuel Hammer in 1969, so it will be used in adults also. So the HTP is both qualitative and quantitative measurement of intellectual ability. But qualitative scoring, on the other hand, is a subjective analysis of a drawing meant to measure the test taker's personality. So this type of scoring of the HTTPS highly personal and can vary from one analyst to another. So similarly to the scoring of other qualitative tests, there is limited empirical evidence to support this validity. But Bach, around 1948 to 1966, he constructed a quantitative HTP scale to measure intelligence, but it is rarely ever used clinically in research. And he also devised a very elaborate scoring system as a personality measure, but most clinicians do not use it in their clinical work. Instead, they analyze each drawing impressionistically, or they use box sign um, approach method. While HTP signs are often used in clinical and research, but psychologists typically understand that no single interpretation is adequate for any drawing sign. So, for example, Dr. Hammer indicates that for some patient, the chimney of a house may represent a phallic symbol, but for the others, it only represents just an important details of the house. So it varied from one analyst to another analyst. Hammer in 1958 devised the chromatic HTP, in which the patient draws with colored or art supplies. He believes that chromatic HTP taps a deeper layer of the unconscious compared with the achromatic HTP. Next is the HTP is one of the most widely used projective tests for children and adults, and it is suitable for any individual ages 3 years old and or older. So the test description, what is HTP or the House 3 person? The House 3 person test is a projective personality test, a type of exam in which the test taker responds to or provides ambiguous, abstract, or unstructured stimuli. So it is often in the form of pictures or drawing. The HTP test is composed of three drawings: a house, a tree, and a person. So individuals taking the test are instructed to draw each of these elements separately, and the drawings are typically done on the blank sheet of paper. So the House 3 personality test is a projective test intended to measure different aspects of personality. So test takers are asked to draw a house, a tree, and a person. And the interpretation of these drawings is used to create a picture of the person's cognitive, emotional, and social functioning. So Emmanuel Bach in the US, and Emil Jocker in Switzerland independently noted that three drawings could reflect underlying personality traits, and Bach added the house drawing as in part of representation of the self. So the HTP test is an effective tool in evaluating brain damage in patients with schizophrenia. Um, the HTP test is also employed as part of a series of personality and intelligence tests, including the Rorschach, the AT, and the WISE, or the Wechsler Adult Intelligence Scale, as a means of personality assessment. So the purpose of the test. The primary purpose of the HTP, or the House 3 is to measure aspects of a person's personality through interpretations of drawing and responses to questions. So it is also sometimes used as part of an assessment of brain damage or overall neurological functioning. And the reason for using HTP are essentially the same reason cited for the Draw a Person test that was discussed by Spencer. So HTP is said to reflect patients' feelings about their home situation, typically represented by the house drawing, and the tree drawing is said to also reflect patients' emotional history and tap deeper layer of personality. So house 3% task theoretical basis. The theoretical underpinning of the HTP is similar to the Draw a Person test. So the patient is set to reflect underlying traits and personality dynamics indirectly. Note that HTP is not inherently tied to any specific psychological school of thoughts such as humanism and psychoanalysis, and instead it is considered a projective psychological assessment technique, which means it is a tool used to gain insight into an individual thoughts, emotion, and personality. But the interpretation of HTP drawing can draw from various psychological perspective, including psychological analysis. So psychometric characteristic of HTP. There are few available norms for the HTP and little material available concerning age-related differences. So there are very limited research about HTP. So little formal research has been done on the HTP since the 1970s, except for a recent study by Voss on 1998. So Voss produces a new scoring system and manual using hierarchical cluster analysis that has good inter-rater reliability. And a scale by Van Houten purports to measure sexual abuse in children, but it has a limited clinical utility. So the test methodology. So the House 3% test takes on average 150 minutes to complete. So therapists can choose between phase 1 and phase 2. So a one-phase test is where a pencil or crayon is used for drawing, and a two-phase test, it uses a crayon in the first phase and a pencil in the second. So each phases has two parts, where the first non-verbal and creative steps is followed by structured or the verbal one. So test takers are instructed to draw a house, a tree, and a person as accurately as possible. They are then asked a number of questions about their drawings. Bach proposed a list of 60 questions. However, trained test givers are free to create their own variation and ask follow-up questions. So how to start? Use 3 pieces of plain white paper. Next is give the first paper and say to the client that, here, I want you to draw as good as house as you can. And then on the next one, you provide another sheet of paper and tell the client to draw as good as tree as you can. And the last one is give the last sheet of paper, or the third sheet of paper, and tell the client, for example, draw as good as person as you can. So note that if the client only draw a profile or head, you have to tell the client like, wait, I want you to draw a whole person and not just the head or profile. So you have to let the client draw like the whole person with hands and feet. So after the pictures have been drawn, ask questions after each picture is drawn. So here are some examples of the questions based on my research. For the house, you have to ask the clients who lives in the house. Are they happy? Do people visit the house? Or what is the house made of? What goes on inside the house? What's it like at night? And what else do the people in the house wants to add in the drawing? For the tree, what kind of tree is it? How old is the tree? What seasons is it in? Who waters the tree? Has anyone tried to cut it down? What else grows nearby? And trees need sunshine to live, so does it get enough sunshine? And for the person, here are the following questions you can use. Who is the person? How old is the person? How does a person feel? Is the person happy? What is the person's favorite thing to do, and what's someone they do not like? Has anyone tried to hurt them, and who looks out for them? So house three-person interpretation is based on the idea of that drawing reflects feelings. So the details of a drawing are seen as representation of various personality traits. So in drawing a house, according to the book, the house is considered being the expression of the respondent's family and respondent's family relations and family values. So although there is no agreement concerning what the house in the tree symbolizes, other than a representation of the self, the house is sometimes said to represent the part of the self that is concerned with the body. However, it is also said to represent the self nurturance, stability, and a sense of belongingness. The roof of a house is said to represent fantasy, intellectual side, and spiritual sides of the individual, while the walls might be related to the test taker's character strength or ego strength. The doors and the windows of the house represents the individual relationship to the outside world and the level of social integration. And lastly, the chimney, it represents, according to Hammer, it represents either masculinity or warmth. But remember that Hammer told us that interpretation of drawing should be vary from one analyst to another analyst. So the tree is thought to suggest the deepest unconscious aspect of the personality. The tree too is said to represent the self. It is sometimes discussed in the literature as representing the patient's sense of growth, vitality, and development. So the branches it may show the degree of social connectedness. A tree with no branches indicates, for instances, that the person has little contact with others. The trunk of the tree is often seen as a representation of inner strength. And the crown of the tree stands for the ideas, thoughts, and self-concepts. So, drawing a person, the person is a symbolic representation of the ideal self and one's social interaction. So the head, it symbolizes intelligence, communication, and imagination. The eyes, it indicates the perception of, it indicates the client's perception of the world. And the hands, it gives information about affectivity and aggressiveness. So So there are several other aspects of drawings that the therapists take into account when analyzing HTP tests. First, we have the dimension of objects. The dimension of objects in the drawings are thought to indicate the levels of self-esteem and confidence. Next is we have the location of objects. The location of objects on the page is also charged with significance. Drawing close to the top of the page are considered being related to dreams and imagination, while the ones at the bottom are connected to physical world. And drawing on the right side of the page is linked to the future. In the center are related to the present, and left is to the past. Next, we have the level of details. The level of details is another revealing factor in outlining the respondent's personality through the drawing. So strokes and lines, the pressure, the firmness, and solidity of strokes and lines indicate determination and decision-making facility. So the same line drawn twice shows insecurity, dissatisfaction, or perfectionism. And and one thing that we need to take account is the test taker's attitude. So therapists should consider the test taker's attitude, the words, the gestures with the drawings. Any display of frustration, anger, or satisfaction is taken into account in test analysis. So a house three-person test can be scored either in an objective quantitative or subjective qualitative manner, as what I have discussed a while ago about qualitative. It is a subjective analysis, but therapists rely on John Bach's comprehensive 350-page manual and interpretative guide in administering and scoring. So I tried to look for the 350-page manual by John Bach, but unfortunately I couldn't find one, so I couldn't really, like, I really want to show you what is it, but I couldn't find any resources about it. I apologize. And next is the quantitative scoring. It provides a general assessment of intelligence. Research shows that the quantitative assessment correlates highly with other well-established intelligence tests compared to the qualitative scoring. Okay, so the range of applicability and limitations. Okay, so the range of applicability and limitations. So a house three-person is used with children, adolescents, and last so to adults. It is not a useful instrument if the clinician is seeking a test that can be scored objectively. So essentially, the same range of applicability and limitations exists for the house three-person as for the draw a person test. Cross-cultural factors. So as with the draw person test, there are significant difference among house three-person tests of subjects and patients of various cultures. So it is important that in the interpretation of drawings of patients from other cultures, to understand cultural effects so that they are not interpreted as a personality issue. Because, for example, as what I have mentioned a while ago, that in other culture, the chimney has different meaning, but it varies from one culture to another. So another culture, it's just the sign of the house, because in the Philippines we do not have a chimney, but in the United States and other Western countries, they have a chimney. So it is important to take note about that also. So, accommodations for populations with disabilities. It is possible to make accommodation for those patients with speech and hearing disabilities, since the simple instruction can be written out for the hearing impaired, and the stories or associations to the drawing can also be written. Legal and ethical consideration of the test. First, because of the available objective scoring systems are primarily used in research and few have been used in clinical application, it is difficult to employ data from the house three-person in forensic setting. Second is several writers engage in the controversy about whether drawings are valid and have described their use as unethical because of the lack of validated scoring system. So current research status of the Hausky person, there are relatively few reliability and validity studies available for the HTP. Thus, the HTP is a rough or non-specific measures of pathology, but it is an undifferentiated measures. Clinical practice and limitations. So the symbolic interpretations are extremely problematic because there are no research data to support them. The interpreter is better off in using the HTP as an impressionistic manner. And lastly is for the future development. So the collection of more normative data is essential if this instrument is to be of any real clinical use. And the task remains a clinical exploratory tool, especially for children, in the identification and exploration of self and family attitudes and conflicts. That's it for this discussion. Thank you for listening, guys. Have a great day ahead.